Hey everyone, this is Sarah with Registered Nurse RN.com, and in this video I'm going to demonstrate how to walk with a cane. Before a patient starts using their cane and practicing with it, you want to make sure that they are wearing a gait belt for safety. In addition, you're going to stand on the patient's weak side in case they lose their balance. So whenever they start using the cane, they want to make sure that they're in the proper position. The position that they want to be in, they want to make sure that they are positioning the tip of the cane at least 4 inches from the side of the foot. And they want to hold the cane on the strong side of the body. So remember that. The cane needs to be on the strong side. Very important concept to remember. So how are they going to actually ambulate with this cane? Well, to ambulate with the cane, what they're going to do is they're going to move the cane with the weak side together forward. So they move the cane along with their weak side together. Then they will move the strong side forward. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.